So that, it's my pleasure to welcome House Speaker Joe Sacacci. Thank you.
Thank you. Thank you, Governor. Thank you all for being here today. A very important day. As the Governor said, the time couldn't be more right today. I want to acknowledge the Governor for his continued efforts on all of the bills. We've had a lot of bill signings, and he's part of the three branches of government. And when you don't have the Governor and obviously the Lieutenant Governor on your side, it makes it that much difficult. So I appreciate the efforts that they have made, not only today, but as we go forward and as we have in the past. These two pieces of legislation are critically important, and I can share with you, they're very personal to me. 8% of Rhode Islanders are diabetic, and I'm one of them. I'm a diabetic. I've been very vocal about it since I've been here in the House. I do not take insulin, but many people who share the same affliction that I do, they take insulin. And this is critically important. People have to make a choice between eating and taking medicine, and taking the medicine on time and the proper amount. And it's gone up exponentially. The cost of insulin has gone up exponentially, and no one knows why. And I can only speculate it's some form of greed. Insulin's been around for 30, 40 years. It's been around, and it's well off patent, and they seem to change it slightly, and then they repatent it. But there's many generic versions out there, and I hope this legislation truly makes a difference. I want to thank AARP, Catherine Warren, and others who have helped us so very, very much. I said Catherine Warren, I meant Catherine Taylor. With the mask, it's hard to see everybody. But I want to talk about the sponsors a little bit of this legislation. I want to recognize my colleagues in the House, of course, my good friend and partner in the House, Leader Blazajewski. Chris has always helped me. He's helped floor manage all of these bills. They go through a committee process. It wasn't easy. It never is easy, and if it was easy, anybody could do it, and that's why Chris is the leader, because he's very talented, he works very hard. I want to recognize, obviously, the chairman of the Health Committee, Steve Casey. He's a new chairman. He's taken over that committee. Both of these pieces of legislation went through his committee. He shows a lot of passion, a lot of drive, and a lot of color. Sometimes that color is in his wardrobe. Today he's quite conservative. We're thankful. And of course, I want to recognize Representative Morales. This was an important legislation. He worked very hard on this. There were 4 or 5 insulin bills. He had one of them, and I remember him giving a very impassioned speech on the House floor, and Representative Brandon Potter, who also is very big in the healthcare field, feels very strongly about the legislation we do. Capping insulin is important. I want to thank my good friend, the sponsor, someone who's worked on this bill for many, many years, Speaker Pro Tem Brian Patrick Kennedy. Brian has fought hard. He's had some family illnesses. His brother has passed. He has been there for his family, and he's been there for Rhode Islanders. He'll continue to be there. Every year, Brian comes up. This is a bill, it's 2 years old. This is a bill 3 years old. It's a bill 4 years. But he fights, and he's with so much passion and so much desire to succeed because he believes he's right on it. And most of the time, he is right. And I'm glad to see that we were able to pass this bill this year. Representative Leona Felix, one of the rock stars of the freshman class. This is so important. Allowing pharmacists to tell people, to tell consumers that there are lower cost options, whether it's generic, whether it's over the counter, whether there's different healthcare plans. The effect that will have on so many middle income people, low income people in Rhode Island. Leona, thank you very much. Thank you for what you've done and continue to do. Thank you for being a very passionate, conscientious, hard-working legislature, and you see the results of that today. And with that, I want to thank everybody for being here, and I want to tell everybody that these are important issues, and we'll continue to tackle them as we come back at session, and we work hard. And it gives me great pleasure to introduce my dear friend and my good friend, my counterpart in the Senate, the President, Dominic Ruggiero, who works just as hard in the Senate as we do in the House. My good friend, President Ruggiero.
Thank you very much, Mr. Speaker, for those kind words.
I want to take this opportunity to recognize the chairman of our Health and Human Services Committee, Senator Josh Miller, who's here today, who was instrumental in moving this legislation along. But I want to also thank my colleagues in the Senate who have been supporters of this issue for a long time. The Senate has made addressing the high cost of prescription drugs one of our top priorities for a number of years. The cost of medications can be a significant burden for our population, especially our elderly population, which is always growing. The Senate worked very closely with AARP to work on this legislative package and was instrumental in moving this along. And I want to thank the members of AARP, not only for their commitment, but also for their input into the legislation and for the assistance they provided us. I also want to thank Governor McKee and Lieutenant Governor Matos for their support of this legislation. They realized the importance of it. Our senior citizens should not have to choose whether to eat, heat, or medicate. We've heard stories where people have reduced their dosages that are recommended by their doctors because of the high cost of prescription drugs. So I think this is a monumental move forward. We're looking forward to continuing to work on the legislation that has been proposed, and also with the assistance of AARP, I think we could pass similar legislation in the very near future. Mostly, I want to commend and thank Senator Walter Felag, who has been a champion of this issue, not only of this issue, but of many issues that have been affecting our senior citizens in the state of Rhode Island. And I also want to thank Senator Melissa Murray for her efforts as far as the insulin legislation. They worked very hard on this issue, and these are complex issues. There's no easy solution. They've sat down with all the stakeholders, worked out legislation, and fortunately, we are here to sign those two bills today. So I want to thank everyone who was involved with this legislation, and hopefully we can move forward and continue to reduce the cost of prescription drugs, not only for our senior population, but also all Rhode Islanders. So thank you all very much, especially Senator Felag and Senator Murray. I also want to commend the House sponsors and also the leadership led by by Speaker Joe Sakachi for their work on the legislation, and also I know Majority Leader Chris Blazewski was very much involved. And also I want to thank my leadership team for their input on this legislation. So thank you to all, and let's keep the momentum going. And at this point in time, it gives me a great deal of pleasure to introduce one of our younger, most aggressive senators, Senator Melissa Murray.
Thank you, Senate President. I would like to thank you for your support. As you stated, controlling the cost of prescription drugs has been a Senate priority. I'd also like to thank Majority Leader McCaffrey and Chairman Miller for their help with this bill. Diabetes affects people of all age groups across every single community. About 1/3 of diabetes patients in Rhode Island use insulin. And as we stated, no one should have to make this decision between buying life-saving medications, paying for their groceries, keeping their lights on, and no one should have to ration their insulin because they cannot afford it. I want to thank the many advocates who testified and helped with this bill, including AARP, the American Diabetes Association, and all of my General Assembly colleagues for supporting this bill, which enacted significant, meaningful action to fight RX greed and lowered the cost of this life-saving drug for all Rhode Islanders. And I'd also like to thank Representative Kennedy, who has been working on this issue for many more years than I. And with that, I would like to introduce Representative Kennedy. Thank you.
Thank you so much. And it is a pleasure to be here today. Mr. Speaker, Majority Leader, Mr. President, good to see you all, as well as my colleagues, Chairman Casey Representative Potter and Representative Morales, who had a similar piece of legislation that was introduced. We were able to get Representative Morales' bill as well as Representative Diaz's bill folded into this, and ultimately I think we came up with a very good piece of legislation that's going to benefit those individuals who have to deal with diabetes and on a regular basis. Rhode Island, like the rest of the country, has experienced a diabetes epidemic. The Diabetes Association estimates that 100,000 people in Rhode Island currently have diabetes, or that's about 1 in 8 adults. And every year, another 5,000 people are diagnosed with diabetes. As was stated, many of them have to use insulin, and without it, they could face devastating consequences, including things such as blindness, kidney failure, heart attacks, strokes. Some people have had to have limbs amputated, and possibly death. So this, I think, represents a major step forward. When we started introducing this piece of legislation several years ago, we were looking at a $50 copay, and I'm glad to see we were able to bring it down to $40. Interesting to note, 8 states that have passed legislation similar to this have a $100 copay. So at $40, I think we have definitely benefited those individuals who need this. 2 states have a $50 copay. So there's 10 states right there that have a higher copay than what we're looking to do here in the state of Rhode Island. This, I think, is going to be a major step forward. I think this is going to save lives in the state of Rhode Island. I'm excited the fact that we were able to get it through the process. Going forward, I think we may have to look at legislation to perhaps address some of the other critical needs of individuals who suffer from diabetes, such as the supplies that they need to use on a daily basis, because those are a major expense as well. I also want to thank Stephen Habe from the American Diabetes Association. Stephen was so involved with this legislation, helped to do research, helped to negotiate some of the language that ultimately went into this legislation. And because of that, I think we have a very strong piece of legislation. So with that, Governor, I thank you for signing this bill, and for those in the state of Rhode Island, I think you have better days ahead. And with that, I would like to introduce Senator Walter Felag.
Thank you very much. I'm honored to join the dais with the Lieutenant Governor, the Governor, the Senate President, the Speaker of the House, and my colleagues in government. The gag clause was a piece of legislation that was important to me because of the fact that it eliminates any excess cost individuals would have to encounter. And as the Senate President noted, this is probably like the 3rd prong of my senior citizens agenda, in that a few years ago we passed the home modification program, then we did the Alzheimer's caregivers program, and now with this consumer protection legislation, we are reaching out to our senior citizens, and with the assistance of AARP and other individuals, we were able to get it passed. And obviously, it would not have been passed the legislation without teamwork, cooperation, and a little bit of communication, obviously, between both branches of the House and the Senate, and also with the executive office. I also would like to commend Chairman Miller and his diligent work on a lot of these health issues that come before his committee. The committee has grown from a minor committee into a major committee now that handles a lot of these important aspects that are important to not only the legislators, but to all Rhode Islanders. As you know, Rhode Island is becoming an older population state, so it's imperative that we pass these pieces of legislation, especially the one I sponsored today, that allows the pharmacists to eliminate the gag clause that's been imposed upon them and provide alternative drug options to those individuals, especially those that are in need or have limited supplies or limited income, so this way they can move forward and have their drugs and live a healthy and productive life. So with that, I'd like to thank and welcome my colleague on the other side, on the House side, Rep. Felix, and her diligent work on the House side of this legislation. Thank you.
Thank you very much, Senator Felag. Thank you to the Governor, Lieutenant Governor, to Senate President, and Mr. Speaker for all your hard work and dedication in ensuring that this legislation actually gets passed and that our residents in Rhode Island have the access that they need to the medications that they take on a daily basis. When we talk about legislation to help improve the lives of individuals and families, we mean legislation like these that are being signed today, that will help improve the lives of people and keep money in their pockets. Most people don't know, as has been stated today, that pharmaceutical companies prohibit pharmacists from informing consumers of alternative medications that are cheaper, whether that's because of out-of-pocket, whether that's generic medication, and so on. Prescription drugs can dramatically improve a patient's quality of life, but the price should never be a barrier, especially to our most vulnerable community members. Bringing an end to these gag clauses, as these contracts are known, has become an integral part of a common goal of lowering drug costs and requiring more extensive transparency at the retail pharmacy. I really want to thank my colleagues in the House and the Senate for working together and voting on this to make this a reality. I want to thank the Governor for signing this legislation today, and I look forward to building on this work to make life-saving prescriptions more affordable to everyone. Thank you. With that, I want to introduce Catherine Taylor from AARP.
Good morning, everyone. And Governor, we must keep meeting like this. This is a good place to be. It's been a great week for people over the age of 50 in Rhode Island. What wonderful bills are being signed on behalf of AARP Rhode Island and our 132,000 members. I applaud the General Assembly for approving the two bills that Governor McKee will sign just after I stop speaking. So thank you, Senator Murray and Rep. Kennedy, for your sponsorship on legislation to cap the monthly cost of insulin, and Senator Felag and Rep. Felix for your sponsorship of legislation to eliminate the so-called gag clause. That's prohibited pharmacists from telling us the lowest cost way to fill our prescriptions, which might not be through our insurance. And I've only been on this job for about 3 months, and so a lot of the work was done by our Associate State Director, Matt Netto, who does a lot of advocacy. He's just working really hard with all of you. And also a big shout out to Stephen Habby of the American Diabetes Association for his leadership and tireless advocacy on the insulin measure. AARP has been at the forefront of calling on federal and state lawmakers to take action to lower prescription drug prices, and is pushing for progress on a number of national policy solutions. But here at AARP Rhode Island, we've been hard at work advocating for state-level action. We hosted a series of well-attended public forums in 2019 to bring people together to tell their stories about the hardship of steadily climbing prescription drug prices. AARP invited lawmakers, state lawmakers, many of you were there, to hear their constituents' plea for bipartisan legislative action to lower drug prices. The pandemic sidelined deliberations on drug price legislation in 2020, but the General Assembly followed through this year. We really followed through and got it done. Thank you so much, Speaker Shekarchi and Senate President Ruggiero, especially for committing to a strong, fair prescription drug price agenda this year and going forward, and we'll be there with you all along. Our 10% or so of our adult population that are living with diagnosed diabetes, as you all said, are having difficulty affording their insulin because the cost has skyrocketed by more than 550% over the last 14 years. And Governor, this is also, and Speaker, this is also personal for me because my late father, who died at the age of 62, also suffered from diabetes, and he used insulin, and he struggled financially. And I cannot even imagine the decisions he made that he protected me from. So this is very dear to my heart for all of you who worked on this. And according to the Centers for Disease Control and Prevention, the high price of insulin can lead some patients to begin rationing their diabetes medication or not fully comply, as it has been mentioned, with dosing as prescribed by their doctor. We need to get those adherence rates up because a 10% increase in insulin adherence rates can produce up to a 29% decrease in overall healthcare costs related to diabetes. That's right. Lowering the cost of insulin for individual patients will bring overall health costs down. So the bill about to be signed today is not only great news for people living with diabetes, it's great public policy. And the second bill will eliminate, as I said, gag clauses in contracts between pharmacies and PBMs that prohibit a pharmacist from informing a consumer if a drug would cost less if the consumer paid out of pocket, rather than through their insurance plan. This is such great news for everyone's pocketbook. Now catching up with other states, we're moving ahead. I'm really excited to be with you next year and to see where we can take fair prescription drug price legislation going forward. So with that, back to you, Governor.